Yeah, hiyo ni mimi nasemanga kuna ndee.
Sauti yangu. By the way, mimi nasikia kuna ndee.
Basi kuna wengine basi nilisikia wakisema sijui kula ndee. So mimi
au ni nani?
Kula ndee kwa nini?
Hala.
Kumbe kuna ndee. Lakini kuna wale wakamba wanasemanga kuna ndee. Me being part of them. Basi wanasemanga kuna ndee.
Mimi nimekuwa nikiimba the wrong lyrics. Mimi nasemanga ndee.
Okay, we are on the same boat. Tuko tuko wengi. Tunasema tuko wakaba peke yetu lakini tuko wengi.
Nesta.
Welcome again. This is the Health Sound Show and this is Shine FM 103.1, the radio that radiates you live. And tumetoka kuwachezea Kuna Day remix ya Jimmy Gate na nani pale?
Jimmy Gate, Kelele Takatifu, Evelyn Mutua, The Giraffe, walikuwa si wengi.
Okay. Hiyo remix ya hao watu wote.
Nimeweza.
Na pia kuna ile pale sijui mnaitanga ampi. Mimi nasemanga ampi.
Ama piano.
Amphipiano. By the way, that's what I always say, amphipiano. Ni ama
Rachel, ama piano.
Okay. Leo nimefunzwa.
Naam.
If you're wondering where you can find us, how you can find us, because tunakuburudisha mioyo wako pale ulipo wakati hata unafanya wakati unafanya hata kazi hapo.
Naam.
This is Shine FM 103.1, the radio that radiates your life, and you can find us on 0709972654. On Twitter handle you can find us at Shine FM 103.
On our Facebook page, Shine FM Daystar, and on our Instagram page at Shine FM 103.1.
And not forgetting on one line.
Or you can text or call me on 0770873338.
Or 0797972773.
Call us, tuambie vile unahisi, vile give us, tuambie everything, anything you want.
Tueleze, unataka tukuchezee nyimbo gani?
Naam.
Tueleze unajisikia vipi leo? Tueleze yani nini tena pale?
Kama umewahi gonjeka hizo magonjwa ulifanya nini? Ama kama kuna mtu unajua mwenye aliwahi hata.
Kama hata kuna home remedies, si lazima kwenda hospitali. Unaweza pia tueleza ni
now that we are Africans, we have a lot of home remedies which can be more effective.
Ukweli. Kuliko hizo madawa zenye tunakula hapa ni chemical.
Tell us,
tuambie. Pia sisi pia tuelimishe.
Naam.
Sisi peke yetu tunajielimisha, pia tunawaelimisha. Wao pia tuambie.
Tafadhali tujengane.
Unajua it's two-way traffic. Sisi tukikwambia, pia sisi tunajielimisha, pia tunakuelimisha. Wewe pia ukipata tuambie, ujielimishe, pia utuelimishe. Naam.
Kabisa.
So today, what's the topic?
Ear infections.
Ushasema.
Nime nini? Sema tu. Labda kuna hawajasikia.
I wanted to do the drum rolls before we introduce the topic of the day.
So, take two.
Forget that it happens. Before we introduce drum rolls.
Yeah.
So our topic of the day is
ear infection.
So today we are going to talk about ear infection. Sijui kama umepata ukiwa hapo kama ushai gonjeka na hii ugonjwa ear infection. Mimi nishawahi kuwa na mtu.
Umewahi kuwa na mtu? Mimi mwenyewe nimewahi kuwa na ear infection.
Mimi rafiki yangu alikuwa ile kila saa kwa hivi anasikia uchungu. Sasa ni ile maji mpaka inatoka. Maji ilikuwa inatoka kwa sijui na pia inatoka na usaa. Ile the pass ilikuwa serious. So ikabidi aende aangaliwe vizuri.
Lakini amepona
sawa. Ilikuwa inatoka na maji na pia usaa. So and then me I can say acheni kuweka earphones. Ile earphones mnaweka earphones and then mnaweka ile sauti
ya juu.
You know this thing inaumiza masikio. And inafanya masikio ile dini huko ndani sijui inaitwa vipi.
Hiyo kitu.
Hiyo kitu.
Eardrum.
So mnaiumiza. Ile inaenda ikiharibika. Ile ukiweka ile muziki, usikia hata ile that time when you're putting loud music you also feel your head.
Ina nini? Vibration inside your head. Hata uwezi.
Sijui also kama ushaipata hiyo.
Unasikianga very.
So I was told by a friend of mine and also my pastor, Mr. Ogore. So he said, don't never put nini. What's this?
Loud music on your ears.
Yes. At least even put like an average or low volume. For you. That will just be for you. Najua watu wengine wanekanga
hadi mtu mwingine kaka niko na anaweza sikia. Surely anaweza sikia wimbo unasikia.
Si ati mtu mwingine hata vipi alikuwa anafanyanga hiyo jambo
hata mimi
kabla niambiwe that's not right for you. You have to put average volume or lower volume. Ama if not that, toa your earphones.
Sikiza kwa radio.
Eka kwa radio.
Na ukae mbali na radio usisiri sana pia tena. Usikae karibu na speaker.
Yeah, so I had a friend who had that the ear infection. Yake but yake it was so serious mpaka anatoa ile maji na usaa. Ikabidi aende direct hospitali. So I don't know if you had a friend who had this or you've ever encountered. For me, I have never encountered it.
Me, I have ever, but mine ilikuwa inatoka hivyo usaa na nini. Yangu ilikuwa tu inauma. Inauma. There's nothing as bad as an earache and a toothache. Hizo vitu ni uchungu.
Because there's a time which we were traveling, ile family traveling. Sasa sile you guys you can get at least we say it's always on a December because it was
December sana travel yeah.
So it was on a December whereby we were going to have family treat. So when we were heading to Amboseli, my brother sino ile also you want kushukisha ile kio usikie ile breeze na pia uone venye kunaendelea huko nje the environment. So when I shukisha the window, my brother was like, funga nasikia uchungu masikio. Ile upepo ile venye inafanyanga inamchapa mpaka nasikia. So I wasn't able to understand what's
wrong na mbona amenini. Akona sensitive
yeah masikio. He's so sensitive with the
baridi. Mi pia tena kukikuwa na baridi sana masikio niuma. Inataka ifunikwe. My ears zinafaa zikuwe warm. So I don't know the association but nilikuja kurealize haitaki baridi.
Acha ile makelele ile zenye gari naenda mbio alafu
hiyo nayo ni sumbui. Baridi tu when it's really cold.
Sasa si nini masikio sasa ni ile there's that when
impact of air inakuchapa.
Alikuwa anasema hivyo. Anasikia uchungu So that's what I've encountered. My brother and a friend of mine who was just removing water and pus from the ear. Yes, so I was asking you a question. Have you ever encountered this? Or do you have a relative or a friend who you know that he or she has encountered this? Do you have?
I have encountered. Na masikio ilikuwa inaniuma vibaya sana and nikaenda kwa hospitali wakaniambia it was too much wax.
Too much.
That was what was causing uchungu. Surprisingly. Or rather, so nikaenda kutolewa.
Wanaekanga maji?
Walieka kitu. There's some sio maji, ni dawa.
It's liquid.
Ni dawa yenye I think inaenda ni liquid. Inaenda ina soften. Then the nini comes out as
nyingi.
Actually
inatokanga nyingi.
Ni tap. Hata nimekumbuka. That was very weird. Imagine nini ikipitishwa kwa masikio yako. A tap like water. Sijui kama ni maji ama ni nini hiyo, but there was a liquid and ilikuwa inatoka na pressure. Sasa wanakuingizia hapa alafu sasa unaona vile na nini hivyo na pressure, it's supposed kuingia na pressure ndio iskume. Iskume hizo vitu. First you're given something to soften the wax and then now you go kwa hiyo kitu inakaka tap spray inatoka mingi then
pressure.
Sasa inaingizwa then hivyo hiyo nini inatoka. Inatoka on this other side. So unashikilia kitu ikitoka.
Sasa you know me okay in TikTok unajua kabla ujaingia zile TikTok lazima unaulizwangwa which things you want.
The topics you like
you follow. So me I kept health things. So there's this other doctor mwenye huwa anafanyanga mambo ya masikio. So nile anaeka maji it run through I think what you said hiyo mambo unapatiwa kitu so that it softens the wax it's true. So wanapatia huyo mtu sijui ana meza ama ni nini.
No, I think
it was something which was kept in the ear.
A drop or something. I don't know. Inawekwa ina soften you.
But I saw that lady. It was a lady. She was given something to drink
before.
So and then now she huyo daktari akaweka it was water. I think juu ilikuwa inakaa
maji colorless liquid, yeah.
So akaweka kwa masikio, so ni ile inatoka na wax. Unaona kwani watu
inatoka mingi
mpaka wanashanganga kwani watu wanakuanga watafu aje. Hata mimi pia naweza kuwa hivi lakini sijui.
Imagine it builds up, you might be surprised how much wax can toka your ear. Yeah, you will be surprised, you won't even know, utashanga. But usipojua kuko ndani is not build up and it's like a canal. So sisi tukichukua earbuds unafikanga tu like hapa tu unafikanga like not even almost even close to half a quarter. So ni mingi along your line when a build up over time. So ikikuwa, which wax is good for your ears, but ikikuwa mingi sana ni mbaya. Sasa hiyo ki build up hivyo ndio inabidi utolee.
Utashangaa hospitali ya masikio.
Hospitali ya masikio peke yake hakuwezi kosa.
Naweza taka niende nikatolewe hizi kama nikaangaliwe sije ikakuwa ina pile up na sijui. Yeah, so we were talking about ear infection.
Yes.
We were giving just reviews on
our experiences.
Yes, and if we have encountered people. Tueleze msikilizaji ambapo unatusikiza.
Naam.
Upatwa na hii ugonjwa wa ear infection ama unashaijua mtu ambaye mnajuana amekuwa na hii shida ya ear infection. Kama unajua, tafadhali tueleze. Tupigie kwa nambari 0709972654 ama kwa 0797972773
au kwa 0770873338. Kiswahili kizungumkuti kidogo. Naam.
Yeah, so ear infection. Yeah. So we are going to give you an overview of what ear infection actually is.
Yeah.
An ear infection occurs when a bacterial or viral infection affects the middle ear. The section of your ear just behind the eardrum, that's where it's being affected mostly.
The section behind your
eardrum. Okay. And then ear infection can be painful because of inflammation and fluid build up in the middle ear.
Yeah.
Venye tu umesema. Inaweza kuwa uchungu when it inflammates and then there's that build up of those
things
up in the middle, those wax in the middle ear.
Yeah.
So mimi sijaijua kama kuna sections of ear lakini
hata pia mimi naona.
I'm also learning. Kuna kwanga na middle, kuna behind.
Hata kuna front.
Yeah. Okay. Ear infection can be chronic or acute. Acute ear infection are painful but short in duration. Chronic ear infection either don't clear up or recur many times. Nile inajirudia. Ama huwa haishi
after a period of time.
Nile umepatiwa madawa unasikia vizuri. Itatena itarudia. That's chronic.
Inashinda
ikirudi ama hata ile ukisema ati inapoa hakuna kitu inapoa, iko tu inaendelea na hiyo uchungu. But there's this other one which is acute infection.
Yeah.
Ni uchungu lakini it's within a short period of time. You'll just feel the pain but you have to bear it, but kumbuka you have to go to the hospital to be checked. Yes.
Yeah.
Chronic ear infection can cause permanent damage to the middle and the inner ear. So if you have chronic, if you know that masikio inashinda ikikusumbua
ama unashuku, tafadhali kimbia
kabla ijaye ukweli.
Ama uangaliwe iweze kuwa solved mapema.
So what causes an ear infection? An ear infection occurs when one of your Estrogen tubes becomes swollen or blocked, causing fluid to build up in your middle ear. Estrogen tubes are small tubes that run from each ear directly to the back of the throat. Causes of estrogen tube blockage include sijaisoma biology. Neza science nasikia nirudi shule high school nisome tu biology.
Pronunciation easy words. Anyway,
hapa si hata hizo ma pronunciation. Sometimes najua nile I was taught only physics. Sasa ile engage mambo ya
you didn't do biology.
I didn't do biology. So it's somehow it's tricky for me. some things even I can't engage.
Yeah.
Hata kama kunaweza kuwa na topic ya mambo ya biology, mimi acha nijitoe kando. Juu nilifunzwa tu physics. Yeah. But then there is that general knowledge which I know about, like not into deeper, no. I can't. So causes of Estrogen tube blockage include allergies, cold, sinus infection, excess mucus, smoking, infected or swollen adenoids, whereby it means tissue near the tonsils that trap harmful bacteria and viruses, changes in air pressure. Okay, I didn't know also sinuses infection can cause ear infection. Where?
Sinus, yeah. Sinus na kwanga ya mapua.
Irritation. So, the risk factors.
So, the risk factors for ear infections are, ear infections occur mostly in young children because they have short and narrow eustachian tubes. Your tube ya maskio. So, infants who are bottle fed also have a higher incidence of ear infections than their breastfed counterparts. Other factors that increase the risk of developing an ear infection are altitude changes, climate changes, exposure to cigarette smoke, pacifier use, recent illness or ear infection. Nakumbuka vile alikuwa anakuambia kukiwa na baridi na umwa na masikio.
I would want to know what is this pacifier use.
Pacifier use, yeah?
Yes, let me just look for it.
Okay, so as you check, we'll be going through the symptoms of ear infections. Utarudi ukituambia.
Yes.
So a few of the common symptoms of ear infections include mild pain or discomfort inside the ear, a feeling of pressure inside the ear that persists, fastness in young infants, juu hawajui kuongea. So wataanza kusumbua. It's up to you to figure out nini mbaya. Past like ear drainage, hearing loss. So these symptoms may persist or come and go. So symptoms may occur in one or both ears. Pain is usually more severe with double ear infection in both ears. I can imagine.
So is this like
I can imagine kama moja tu ndo unasikia kichwa yako inaruka?
Hiyo kupata zote mbili.
So chronic ear infection symptoms may be less noticeable than those of acute ear infections. Children younger than 6 months who have a fever or ear infection symptoms should see a doctor immediately. So always seek medical attention if your child has a fever higher than 102 Fahrenheit, 39 degrees Celsius, or severe ear pain.
Yeah, so I found the pacifier.
Yeah.
Yes. Okay, pacifier helps parents and infants get through periods of crying. When the infant is either not hungry or too full to eat, but still needs the comfort and sucking provides. The comfort that sucking provides. Pacifier can be very helpful to parents in those early months. Pacifier helps babies soothe themselves during period of crying. Nize vitu zinawekwa kwa basi najuliza, what is this pacifier use? Kizungu inatumiwa.
Kizungu mkuti.
Mpaka hata tunajuliza where?
Kizungu mkuti.
Mbona watu wanatumianga majina makubwa unadhanianga ili dili?
Until sasa you find out ni ile kakitu. Ama we've never thought of the name. Na mnyonyi ama?
Sisi tunataka mnyonyi. Ni mnyonyi ukweli. Ukweli. So, how are ear infection diagnosed? Your healthcare provider will examine your ears with an instrument called an otoscope that has light and magnifying lens. Examination may reveal. So wanatumianga otoscope.
Kupima huko ndani.
Kuangalia huko. Juu hii iko na light na magnifying lens. So examination may reveal redness, air bubbles, or pus-like fluid inside your middle ear. Fluid draining from the middle ear, the perforation in the eardrum, the bulging or collapsed eardrum. If your infection is advanced, Your doctor may take a sample of the fluid inside your ear and test it to determine whether certain types of antibiotic-resistant bacteria are present. They may also order a computed tomography CT scan of your head to determine if the infection has spread beyond the middle ear. Gosh, this thing can be spreadable.
It's scary. Imagine kwa kichwa yako inaendelea inasonga
inatoka kwa masikio inaenda mpaka kwa kichwa.
Imagine.
Serious? Okay. Finally, you may need a hearing test, especially if you are suffering from chronic ear infection. Okay. How are ear infection treated? Most mild ear infection clear up without intervention. Some of these following methods are effective in revealing the symptoms of a mild ear infection. Apply a warm cloth to the affected ear. Take over the counter OTC pain medication such as ibuprofen, Advil, or acetaminophen, Tylenol, or acetaminophen or Tylenol. Find ibuprofen or acetaminophen. You can find this medicine online. The ibuprofen and acetaminophen. Use OTC or prescription ear drops to relieve the pain. Take OTC such as
pseudoephedrine.
Nisaidie ndugu, nisaidie.
Ngumu. Pseudoephedrine. Yeah, and then mnunua hizo.
And the other one?
Congestion. God,
Well, if your symptoms get worse or don't improve, you should schedule an appointment with your doctor. They may prescribe antibiotics if your ear infection is chronic or does not appear to be improving. If a child under the age of 2 has an ear infection, a doctor will likely give them antibiotics as well. It is important to finish your entire course of antibiotics if they are prescribed. Surgery may be an option if your ear infection isn't eliminated with the usual medical treatments, or if you have many ear infection over a short period of time. Most often, tubes are placed in the ears to allow fluids to drain out. That's what we said, right?
Yeah. Ile ya kutoa.
Yeah, ya kutoa.
Inatoka on this other side, yeah.
In case that involved enlarged adenoids, surgical removal of the adenoids may be necessary if it's that serious.
Yeah.
So
inabidi surgery under the knife. So what can be expected in the long term? So ear infections usually clear up without intervention most of the time. But they may recur. These rare but serious complications may follow an ear infection. Nitazitaja. So hearing loss, speech or language delay in children, mastoiditis, which is an infection of the mastoid bone in the skull. As we said, iwe ina spread kwa kichwa. So inaweza cause hiyo. Meningitis, which is a bacterial infection of the membranes covering the brain and spinal cord. A ruptured eardrum can also occur. So how to prevent the ear infections? The following practices may reduce the risk of an ear infection. Msikie kabisa, msikie vizuri. So washing your hands often may reduce the risk of ear infection. Avoiding overly crowded areas. I wonder how that means, but yeah, avoiding overly crowded areas. Foregoing pacifiers with infants and small children. Mnyonyi, pacifiers. Breastfeeding infants. Avoiding secondhand smoke. Keeping immunizations up to date. Yeah. And so for everything you should know about ear infections in adults. So ear infections may be common in children than in adults. That one we know. But grown-ups are still susceptible to these infections. Unlike childhood ear infections, which are often minor and pass quickly, adult ear infections are frequently signs of a more serious health problem. If you're an adult with an ear infection, you should pay close attention to your symptoms and see your doctor immediately.
Okay. It's tough.
Yeah.
Yes.
Stuff. So adults mjichunge.
Yeah. So with those, we have given you some symptoms
of the main types. There are 3 main types of infections.
Yeah.
They correspond to the 3 main parts of the ear. Like unakuwa tukishanga kuna parts of the ears. Kuna inner ear, kuna middle ear, and kuna outer ear. So for the inner ear infection, a condition diagnosed as an inner ear infection may actually be a case of inflammation and not an actual infection. In addition to ear pain, symptoms include dizziness, nausea, vomiting. Inner ear trouble may be a sign of a more serious condition, such as meningitis.
Yes.
Yeah.
So the middle ear infection, we are going to look at the middle ear infection, then we go for a short break, and then we'll be back. We'll be back with more information about the ear infection. The middle ear is the area right behind your eardrum. A middle ear infection is also known as otitis media. Media sasa imeingizwa mpaka kwa ugonjwa. Here. Middle ear infection it's also known as otitis media. It's caused by fluid trapped behind the eardrum. In wakati wa swimming.
Yeah, vile unasikianga inakwama.
Me always,
that's an annoying feeling. I hate it when that happens.
I always jump. That's what I used to do.
Oh, it works?
Yeah, it works. Imagine when I was doing my swimming competition when I was still young.
You can still do it.
So maji ilikuwa inaingia kwa masikio. So what you were advised kwanza with the coach, okay, where you are, God bless you and may you rest in peace. And sasa alikuwa anatuambia uruke mpaka usikie maji imeanza kutoka. So
ukiruka
inatoka. It's working. So it's caused by fluid trapped behind the eardrum, which causes the eardrum to bulge. Along with an earache, you may sense fullness in your ear and have some fluid drainage from the affected ear. Otitis media can be with a fever. You may also have trouble hearing until the infection starts to clear. So that's the middle. I think let's say just about the outer ear infection.
Okay.
The outer ear infection is that part of your ear that extends out from your eardrum to the outside of your head. An outer ear infection is also known as otitis externa. An outer ear infection often starts as an itchy rash. The ear may become painful, tender, red, and swollen.
Okay.
So if you have that outer ear infection, unaweza kuwa na uchungu, the tenderness, and the redness, swollen. Redness and the swollen. Yeah. So we have talked.
Yeah.
Yeah. We have talked about. We have gone through the overview
of an ear infection, how they can be prevented, how they're caused, the symptoms. Yeah, so far so good.
Yes, the causes, everything. So we'll be back and we are going to talk about the causes of each and every ear infection.
Yeah.
So stay tuned. This is Shine FM 103.1, the radio that radiates your life and keeps you with more information.
Go.